Cardiovascular health becomes increasingly important after age 60. Regular physical activity is one of the most effective ways to support heart health, manage blood pressure, and maintain independence. Today we're covering 4 exercises specifically beneficial for cardiovascular health in older adults. These are low-impact movements that can be performed at home with minimal or no equipment. Each targets different aspects of cardiovascular function, aerobic capacity, muscle strength, circulation, and overall functional fitness. Before we begin, this is educational content, not medical advice. Always consult your healthcare provider before starting new exercises, especially if you have existing heart conditions, high blood pressure, or other health concerns. Never stop or change medications without medical guidance. Understanding cardiovascular exercise after 60. After age 60, several cardiovascular changes occur. Heart muscle may become slightly less efficient, blood vessels may lose some elasticity, maximum heart rate typically decreases, and blood pressure often increases. However, research consistently shows that regular appropriate exercise can significantly improve cardiovascular health at any age. Regular aerobic exercise can help lower blood pressure by 5 to 10 mm of mercury in people with hypertension, improve heart efficiency and stroke volume, enhance blood vessel function and elasticity, support healthy cholesterol levels, and improve circulation throughout the body. The key is choosing appropriate intensity. For older adults, moderate intensity exercise where you can talk but not sing comfortably is typically ideal. This provides cardiovascular benefits without excessive strain. Exercise 1, Brisk Walking for aerobic fitness. The first and most accessible exercise is brisk walking. This is aerobic exercise that elevates your heart rate moderately and sustains it, providing the stimulus your cardiovascular system needs to strengthen and adapt. Brisk walking means walking at a pace that makes your heart beat faster and your breathing increase, but you can still hold a conversation. This is typically 3 to 4 miles per hour for most older adults, though your comfortable pace may differ. Walking provides numerous cardiovascular benefits. Regular brisk walking can lower systolic blood pressure by 5 to 8 mm of mercury and diastolic by 3 to 5 mm. It improves heart efficiency, meaning your heart can pump the same amount of blood with fewer beats. It enhances circulation to all tissues including the brain. It supports healthy blood sugar regulation which affects cardiovascular health. And it reduces inflammation throughout the body. Here's how to approach brisk walking safely. Start where you are. If you can only walk 5 minutes, that's your starting point. Gradually increase duration before increasing intensity. Aim eventually for 30 minutes most days of the week, but build up slowly over weeks. Walk at a pace where you feel your heart working but can still talk in short sentences. Use proper footwear with good support and cushioning. Walk on safe, even surfaces when possible. If balance is a concern, walk near stable support or use a walking aid if recommended by your healthcare provider. Important safety considerations: if you experience chest pain, severe shortness of breath, dizziness, or irregular heartbeat during walking, stop immediately and seek medical attention. These could indicate cardiovascular problems requiring evaluation. If you have significant heart disease, recent cardiac events, or uncontrolled high blood pressure, get medical clearance before starting any walking program. Start very conservatively and progress gradually. What to realistically expect: with regular walking 5 to 6 days per week over 8 to 12 weeks, you may notice improved endurance during daily activities, easier breathing during movement, modest blood pressure reductions if you have hypertension, better sleep quality, and improved mood and mental clarity. What you should not expect: dramatic overnight changes in blood pressure or immediate cardiovascular transformation. Benefits accumulate gradually over weeks and months. Walking alone may not fully control blood pressure if it's significantly elevated. Medications may still be necessary, and that's normal. Exercise 2, Chair Squats for lower body strength. The second exercise is chair squats, which build lower body strength, crucial for cardiovascular health. You might wonder how leg exercises help your heart. The answer is that your leg muscles, particularly your quadriceps and glutes, are the largest muscles in your body. When they contract, they help push blood back toward your heart against gravity. This is sometimes called the muscle pump, and it significantly aids circulation. Strong leg muscles mean your heart doesn't have to work as hard to circulate blood. This can help lower resting heart rate, improve circulation to reduce swelling in lower extremities, support blood pressure regulation, and reduce cardiovascular strain during daily activities like climbing stairs. Here's how to perform chair squats safely. Sit in a sturdy chair with feet flat on the floor, hip width apart. Cross your arms over your chest or extend them forward for balance. Lean slightly forward from your hips and press through your heels to stand up. Stand fully upright at the top. Pause briefly. Slowly lower yourself back down with control until you lightly touch the chair seat. That's 1 repetition. Start with 5 to 8 repetitions. Rest for 1 minute. Perform 2 to 3 sets. Practice 3 to 4 times per week. Important form points: keep your weight in your heels and midfoot, not your toes. Don't let your knees cave inward, keep them tracking over your toes. Stand fully at the top of each repetition, don't stay partially bent. Lower yourself slowly with control, the lowering phase builds important strength. Modifications: if standing without hand support is too difficult initially, lightly touch the chair arms for assistance. Progress to less support over time. If full depth is challenging, use a higher chair or place cushions on the seat to reduce how far you lower. As you get stronger, remove cushions to increase depth. What to realistically expect: with regular practice 3 to 4 times per week over 6 to 10 weeks, you may notice easier standing from chairs and toilet, improved stair climbing ability, reduced leg fatigue during walking, and possible modest improvements in blood pressure and resting heart rate. Building leg strength takes time. Don't expect rapid changes. Progress is gradual, and that's appropriate. Exercise 3, Wall Push UPS for upper body strength. The third exercise is wall push-ups, a modified push-up that builds upper body strength while supporting cardiovascular health. This might seem surprising. How do arm exercises help your heart? Upper body muscles, particularly chest, shoulders, and arms, play a role in circulation. When these muscles are strong and active, they help blood return from the upper body to the heart. This improves overall circulatory efficiency. Additionally, wall push-ups improve posture, which affects breathing. Good posture allows full lung expansion, meaning more oxygen intake with each breath. This reduces how hard your heart has to work to oxygenate your body. Wall push-ups also strengthen muscles you use for daily activities like pushing doors, lifting objects, and supporting yourself, reducing cardiovascular strain during these tasks. Here's how to perform wall push-ups. Stand facing a wall, about arm's length away. Place both hands on the wall at shoulder height and shoulder width apart. Keep your body straight from head to heels. Slowly bend your elbows, bringing your chest toward the wall. Keep your elbows at about a 45-degree angle from your body, not flaring straight out. Lower until your nose is a few inches from the wall. Pause briefly. Push back to the starting position, exhaling as you push. That's 1 repetition. Start with 5 to 10 repetitions. Rest for 1 minute. Perform 2 sets. Practice 3 times per week. Form reminders: maintain a straight body line throughout, don't let your hips sag or pike up. Keep your core gently engaged. Move with control, taking 2 to 3 seconds to lower and 2 to 3 seconds to push back. Breathe naturally, don't hold your breath. Progression: as you get stronger, step your feet further from the wall to increase difficulty. You can eventually progress to using a counter or sturdy table for a more challenging angle. Only progress when current level feels comfortable for 10 to 12 repetitions. What to realistically expect: with regular practice 3 times per week over 6 to 10 weeks, you may notice improved upper body strength for daily tasks, better posture and breathing capacity, reduced shoulder and neck tension, and contribution to overall cardiovascular fitness when combined with walking. These aren't dramatic cardio exercises but support overall circulation and functional capacity. Exercise 4. Seated or standing leg raises for circulation. The fourth exercise is leg raises, which specifically target circulation in the lower body. This can be done seated or standing depending on your balance and capability. Poor circulation in the legs is common after 60, especially with increased sitting. This can lead to swelling, discomfort, and increased cardiovascular workload. Leg raises activate calf and thigh muscles, promoting blood return from legs to heart, reducing pooling in lower extremities, supporting healthy blood pressure, and strengthening muscles important for walking and balance. Here's how to perform seated leg raises. Sit upright in a sturdy chair with feet flat on the floor. Hold the chair sides for stability if needed. Slowly lift your right leg straight out in front of you. Hold for 3 to 5 seconds at the top. Slowly lower it back down with control. Repeat with your left leg. That's one cycle. Perform 8 to 12 repetitions per leg. Do 2 sets. Practice daily or most days of the week. For standing leg raises, if balance allows, stand next to a counter or sturdy furniture for support. Hold the support with one or both hands. Stand on your left leg, slowly lift your right leg forward, keeping it relatively straight. Hold briefly. Lower with control. Perform 8 to 12 repetitions. Switch legs. 2 sets per leg. Important considerations: move slowly and with control, don't swing or use momentum. Breathe naturally throughout. If standing, always have stable support nearby. If you have significant balance problems, stick with the seated version. You should feel muscle engagement in your thighs and hips, not pain in joints. What to realistically expect: with daily or near daily practice over 4 to 8 weeks, you may notice reduced leg swelling or heaviness, improved circulation sensation in lower legs, better leg strength for walking in stairs, and contribution to overall cardiovascular health through improved circulation. These are gentle exercises. Don't expect dramatic changes but rather gradual improvement in comfort and function. Creating a cardiovascular exercise routine. Here's how to combine these 4 exercises into a sustainable routine. Walking is your primary cardiovascular exercise. Aim for 30 minutes most days, built up gradually over weeks or months if starting from a sedentary baseline. This is your foundation. Chair squats, wall push-ups, and leg raises are supplementary strength and circulation exercises. Perform these 2 to 4 times per week, not necessarily on the same days. A sample weekly routine might look like this: Monday, brisk walk 30 minutes, chair squats and wall push-ups. Tuesday, brisk walk 30 minutes, leg raises. Wednesday, brisk walk 30 minutes. Thursday, chair squats and wall push-ups. Friday, brisk walk 30 minutes, leg raises. Saturday, gentle walk 20 minutes, all 3 strength exercises. Sunday, rest or very light walking. Adjust this based on your current fitness level, health status, and how your body responds. Some weeks you might do less, and that's okay. Consistency over time matters more than perfection each week. Important limitations and medical context: these exercises support cardiovascular health but exist within broader medical context. They don't replace medications prescribed by your doctor. Never stop or reduce blood pressure or heart medications without medical supervision. They may not be appropriate for everyone. Those with severe heart disease, recent cardiac events, uncontrolled hypertension, or significant orthopedic limitations need medical clearance and possibly physical therapy guidance first. They work best as part of comprehensive approach including appropriate diet, stress management, adequate sleep, medication compliance, and regular medical monitoring. You should consult your healthcare provider before beginning if you have any cardiovascular disease, uncontrolled high blood pressure over 160/100, recent heart attack, surgery, or cardiac event, significant shortness of breath or chest pain with minimal exertion, or uncertainty about appropriate exercise for your situation. Monitoring your response when exercising. For cardiovascular health, it's important to monitor how your body responds. Positive signs include feeling energized after exercise, not exhausted, gradual improvements in endurance over weeks, better sleep quality, and feeling of well-being. Warning signs to watch for include chest pain or pressure during or after exercise, severe shortness of breath that doesn't resolve quickly with rest, dizziness or lightheadedness, irregular heartbeat or palpitations, or unusual fatigue lasting hours after exercise. If you experience warning signs, stop exercising and contact your healthcare provider. These could indicate your exercise intensity is too high or that underlying cardiovascular issues need attention. Realistic timeline for cardiovascular improvements. Cardiovascular fitness improvements are gradual. Weeks 1 to 4, your body is adapting to increased activity. You may feel more tired initially as your body adjusts, early improvements in how you feel during daily activities. Weeks 4 to 8, noticeable improvements in endurance, possible modest blood pressure reductions begin, easier breathing during movement, improved sleep quality. Months 3 to 6, clearer cardiovascular benefits apparent, continued gradual blood pressure improvements if you have hypertension, better overall energy and functional capacity, established sustainable routine. The goal isn't rapid transformation but gradual sustainable improvement that supports long-term cardiovascular health and independence. Conclusion: these 4 exercises, brisk walking, chair squats, wall push-ups, and leg raises, provide a comprehensive approach to supporting cardiovascular health after age 60. Walking provides the primary aerobic stimulus your heart needs. The strength exercises support circulation, reduce cardiovascular workload, and maintain the functional capacity needed for daily activities. This isn't about dramatic overnight changes. It's about consistent, appropriate movement that gradually strengthens your cardiovascular system, helps manage blood pressure, and supports long-term health and independence. Start conservatively with 1 or 2 exercises. Build gradually over weeks. Listen to your body. And maintain regular communication with your healthcare provider about your exercise program and cardiovascular health. Thank you for watching. If you have specific concerns about cardiovascular exercise, appropriate intensity, or exercise with existing heart conditions, consult with your healthcare provider or a cardiac rehabilitation specialist for personalized guidance. Subscribe for evidence-based information on cardiovascular health and movement for older adults, practical guidance grounded in research that respects medical complexity while providing actionable steps. The goal is sustainable exercise that supports your cardiovascular health within the context of your overall medical care.